we create clinical practice guidelines, we need a good overview of all the published evidence comparing the effectiveness of one treatment with another in terms of outcomes. In the prostate cancer setting, examples of outcomes are things like cancer recurrence or harms associated with treatment, such as urinary incontinence. One of the problems researchers frequently come across when reviewing the literature about the clinical effectiveness of treatments is outcome reporting heterogeneity. This problem consists of two main things: inconsistency, where different outcomes are reported in different trials, and variability, where the same outcomes are reported but they are defined and measured differently. For example, when reviewing the outcomes reported in prostate cancer research, we found many different ways of defining biochemical recurrence and many different tools used to measure urinary function. A solution to the problem of outcome reporting heterogeneity is a core outcome set, which is defined as an agreed, standardized collection of outcomes which should be measured and reported as a minimum in all trials for a specific clinical area. Within the Pioneer project, one of our main aims was to develop core outcome sets which were applicable for clinical trial research, as well as routine clinical practice, and could be used for standardizing outcome definitions in big data research. If outcomes and measurements are standardized, and we can increase the consistency of reporting of relevant outcomes, this will improve the critical review process and statistical synthesis of data, which will support the creation of and utility of clinical practice guidelines and will ultimately facilitate patient and clinician decision-making.
The core outcome set developed by Pioneer will enable researchers in future to compare their results, as it will create homogeneity in terms of the outcomes used in their studies. At the moment, it's very difficult to compare findings because everybody uses slightly different measurements for the outcomes, and hence it then becomes difficult to draw meaningful conclusions. So by creating this homogeneity and encouraging researchers going forward to use these measurements, these outcome measurements in their studies, will be in a better position to combine all the evidence and all the studies, which will lead to better conclusions, better evidence, which will then have an impact also on the care for our patients.
Patient-reported outcome measures, PROMs, are tools that try to measure constructs indirectly. Across healthcare, different and disease-specific PROM instruments have been developed. PROMs can be applied to provide a clinically relevant, patient-focused and reliable perspective on quality of life and patient symptom condition with a specific disease. Clinicians can administer PROMs to patients in routine care. Each patient gets a specific questionnaire score based on their subjective status. This score should reflect an underlying construct, for example, urinary function or patient's quality of life. In order to assess a specific PROM to patient, it is important to evaluate its measurement properties such as validity and internal consistency. So researchers and clinicians should be encouraged to use the PROMs with the highest quality evidence underpinning their psychometric properties.
The Pioneer work is finalized to evaluate the psychometric properties of each identified PROMs regarding the patient's quality of life. This research has a significant impact on clinical experience because it gives the possibility to analyze and create a list of the stronger tools in statistical and qualitative level to investigate and assess the well-being of subjects with a specific organic pathology. The evaluation work of PROMs allows the clinician to understand patient experience and to improve greater awareness on patient's life situation, not only in an organic point of view, but also mental health. This deeply study permits clinicians to intervene better and timely on a critical situation, ensuring a personalized treatment to be subject focused on his needs.